Today we are going to take a brief look at managed care organizations. Henry Kaiser, a wealthy industrialist in the 1930s and 1940s, brought attention to the inefficiencies of the fee-for-service style of medicine. In 1945, he needed doctors for his construction crews working in the remote areas in the northwestern United States. There were very few doctors in the area. Kaiser's solution was to hire his own doctors and pay them a set fee for treating his construction workers. After World War II, he opened this system to the public under the name of Kaiser Permanente. This solution to the inefficiencies of the fee-for-service plans inspired President Nixon to urge Congress to enact legislation that would stimulate the prepaid plans. He then signed into effect the Health Maintenance Organization Act of 1973. Managed care can be described as very complex, with various systems and arrangements for healthcare that include planning and delivery of healthcare, along with the evaluation of the received care. Managed care has become increasingly complex due to the way in which services are delivered, performance management, and technological advances. There are many organizations that use managed care. A few are health management organizations, insurance companies, Medicaid, Medicare, individual providers, and medical management firms. We're going to look at 4 types of managed care organizations: the HMO, or Health Management Organization, the PPO, Preferred Provider Organization, POS, Point of Service and HMO Plan, and the FFS, or Fee for Services Plans. Management care organization includes members or an enrolled population and a select network of providers. Incentives are offered to members to use those selected providers. There is a fixed budget or prepaid premiums, and the focus is primary care, but preventative care is also offered. Looking at the HMO, or Health Maintenance Organization, we see it is an organized healthcare system that focuses on the delivery and finance of healthcare. They offer a restricted choice of providers, have enrolled members, a fixed prepaid fee, and the HMO also offers comprehensive health services. The PPO, or Preferred Provider Organization, contracts with insurance companies and employers to provide care from a selected group of preferred providers. Consumers are allowed to use providers that are not in the network, but they will pay more in out-of-pocket expense. The PPO offers a network of providers. The pay rates to the providers are negotiated. Incentives are offered for consumers to use the preferred providers. They also offer quality improvement programs. POS, or Point of Service, is a hybrid HMO plan that allows consumers to use out-of-network providers, but they will have to pay more for out-of-pocket expense. Consumers have a more variety of choices for providers, and there's also the possibility of more cost control than a PPO. Point of service is the fastest growing part of managed care. In a fee-for-service plan, general practitioners have their own individual offices. The patient selects the provider they prefer, who diagnoses health problems, and then prescribes treatments. The provider then bills the insurer after the services are rendered. There is a moral hazard that exists in the fee for services. Because the insurance company pays for all care, consumers are not interested in the cost of that care. Consumers do not have an economic incentive to help lower the cost of their health care. So they do not forgo unnecessary care, and the consumer does not shop for the lowest cost of the health care. There is potential to managed care. It has the potential to control health care cost. It can also improve the quality of care received. It can help improve coordination and communication between healthcare providers, such as doctors, nurses, billing. It can also improve access to care and promote wellness and enhance accountability among providers. There are some serious concerns to managed care. Managed care is associated with high administration cost. Necessary care can be withheld due to restrictions on cost. And due to the high cost of technology, there is lack of access to state-of-the-art care. There is also an impairment in continuity of care and a loss of provider advocacy for patients. Research on managed care results is limited. The resulting conclusion from studies are mixed as to the success or failure of managed care. The focus is more on whether or not managed care actually works, when the focus should be more on what actually works in managed care. Managed care began unraveling in the 1990s. In the early 1990s, there was high enrollment with low healthcare inflation. That same high enrollment in for-profit health management organizations caused a backlash. There was a lack of quality of care. Personal accounts of poor health care and poor quality of health care were rampant in the media. The late 1990s strong economy only served to reinforce opposition to managed care. Companies began to offer less restrictive care, or PPOs. In return, this contributed to the rising healthcare cost. With the advent of companies offering PPOs, the lines between managed care and non-managed care began to blur. Managed care had long been dominant in the healthcare industry, but it contained cost by limiting services to consumers. This slowly began to change with less restrictive practices when compared to non-managed care. Studies seem to imply the merging of the two, possibly due to non-managed care becoming more restrictive. The 2000 election seen healthcare take a front seat as one of the most important issues of the election. 84% of all Americans surveyed said it was the reason they were going to vote. Unfortunately, the current political environment will affect healthcare for all Americans. The Affordable Care Act of 2010, which relies on state cooperation, has seen strong political opposition from the states due to the individual mandate. It is also highly publicly contested. Lawsuits have been filed to challenge the validity of the Affordable Care Act. Amnesty legislation concerning the status of illegal immigrants, if passed in 2015, will flood the healthcare industry with millions of new users, taxing an already strained system. Lawsuits filed by the state of Texas could also affect amnesty legislation. With a change in the political landscape of Congress, healthcare stands at a crossroads. Congress, which has been under Democratic control for many years, but is now under Republican control, seeks to repeal the Affordable Care Act. If the Affordable Care Act is repealed by a Republican Congress, or if amnesty legislation is passed, both of these pieces of legislation will drastically affect healthcare in the future. I hope this has been informative and interesting. Thank you for watching.